It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
So folks, we continue our journey to make you feel better and keep you healthy. Today we're going to talk about interesting things about, how many of you have back pain? Everyone. I'll put my hand up for that. Well, we have Dr. Ammar Abbasi here, who's the medical director of the Back Pain Center at the Health and Wellness Center at Hazleton. And we have Dr. Dan Gavio, who is not new to chiropractic medicine, but he has joined the Health and Wellness team at the center. And it's exciting, folks. You know, I know every one of you get, oh, my aching back or whatever. There's a lot of pain. You'll learn a lot about what's going on today and how you can feel better. Dr. Ammar, how are you?
Good to see you.
Nice to see you again.
Thanks for having me back.
So, well, listen, the ratings were so great, we had to bring you back into this, okay? And Dr. Gavio, welcome. Thank you. It's always a pleasure. So tell me a little bit, Doctor, about your background, because it's been 2 years since you've been on the show. A little bit about yourself.
Sure. My field is physical medicine and rehabilitation, so I really look at conservative ways of treating patients or people with joint pain or muscle pain. Is my primary focus, and as well as back pain being one of those: hips, knees, ankles, joints. And you know, I came here. I've been 18 months here or so from New Jersey, having a great time. Happy that the community's welcomed me, and did my training in Robert Wood Johnson University, which now became Rutgers Medical School.
So you used the word here, conservative methods. Okay. Now, first of all, sometimes people have pain.
Yeah.
It doesn't necessarily have to be in the back. It could be, you know, their arms, their legs. What are the general areas of pain? And then, you know, we get a pain. Do I have to run to you immediately? When is it that I should be calling you and the pain is, you know, enough that I should be recognized to call a doctor?
Well, I think one of the most important things in evaluating pain is to know what's causing the pain. Our bodies have a lot of different structures in there that can cause pain, and what we try to identify in the office and try to find out so that we can treat the pain is to find out what is causing the pain, and that's done through talking to the patient and doing a careful examination and reviewing any studies or things that they've had done before, like x-rays or MRIs. When I say conservative, what I really mean is that we're non-surgical. If something needs an operation or needs surgical intervention, we absolutely have a system of physicians that we send to, surgeons that we send to for those types of patients. But for most things, we can start off with conservative methods or treatment in a sense that doesn't require immediate surgery. So some things for you that, let's say, or for anybody that comes in with, let's just keep it to back pain. When do you have to run? Well, if you have severe pain, obviously you want to see a physician about that and get that evaluated. Any weakness in the legs, numbness or tingling shooting down the legs that's getting worse or becoming persistent is important. Any changes in bowel or bladder, where we use that term incontinence, meaning that all of a sudden maybe you lose your bowel or bladder and you didn't know you had to go, that's extremely important. That's an emergency. You need to get evaluated. And you know, those are the absolute major things. Other things that sort of may take time to show up is things like an unexplained weight loss. You know, so if you've lost a couple of, you know, maybe 10 pounds or more, and you didn't intend to lose that type of weight, and you're having pain at the same time, it should be, you know, evaluated further. Fevers associated with back pain also should be more carefully looked at. So those are all things that we say, you know, definitely get it evaluated.
See, that's interesting because, again, those are areas that you never would think. If someone is losing weight, they don't know why they're losing weight, or if they have incontinence and something happens, or if they're having tingling in their legs or their arms, and it's getting persistently worse, that's when they should be giving you a call. Now, the good thing is, and correct me if I'm wrong, the good thing is that you do have, when they come to you, okay, there are solutions here, correct?
Absolutely. I mean, again, the first and at the crux of it, the most important is to find out what's causing this pain. Is it a bone issue? Is it a muscle issue? Is it a joint issue? There's discs which act like cartilage in between bones. Is it the disc that's causing the pain? Is it nerve related? Is it related to the spinal cord? So that the exam and the history all goes into sort of figuring out which piece that is, and that tells us which route of treatment we take.
All right, now, if someone's having discomfort, you're saying primarily most of your patients have with the back, right?
Since we started the back pain center, yes, but we treat everything.
Everything, okay. What's the most common one?
Back pain.
Back pain, okay. Well, all right. So, but I mean, again, I want the viewers to know that any kind of pain at all, you know, you're involved with, okay? So if the process would be, you know, you often hear some, my aching back, okay? And it's, where primarily do most of these pains from the back evolve from?
It's really, there's so many different reasons why. I mean, it can be muscular based from the muscles being very tight. It could have something to do with the way the person walks. Is it knee pain that caused back pain or hip pain? Is it the back or is it the hip that's causing the problem? So that's why it's so important to get evaluated, because at the end of the day, it could be something very easily fixable and that can really improve someone's quality of life and ability to do things that they love to do. You know, I would say primarily the more often than not, it's muscular based that is the reason why. The muscles in the low back sometimes are the more common things that I see. But there's so many different reasons why to have back pain that it really should be evaluated. I mean, I had a patient that came in, had severe back pain, and she was feeling more and more weak, but she didn't have any other signs, and we found out that she actually had colon cancer. And that's how that back pain was the way that it sort of manifested and came out. She didn't have any other symptoms.
Now, I know people may think, well, I'm having back pains, I have colon cancer, but that's not the point. The point is that it's best, because you're looking at the biggest baby here, okay, going to doctors. Thank God I'm going and getting my checkups. There's always that fear, you know, the people, you know, well, it'll go away. You know, let me take a couple aspirin. It'll go away, all right? Well, the point is that it's always best to get there and get it checked, because early prognosis is the best, correct?
Absolutely.
So if you're experiencing any kind of pain whatsoever, the best thing is to give you a call. Folks, let me give you Dr. Abbasi's phone number. That's 570-501-6380. Excuse me. Now, Dr. Gavio, how you been?
Good, how are you?
Good. Is the family all right?
Yeah, excellent.
Okay. Now, your involvement, okay, as a chiropractor, which I think is interesting, okay, and you're working with Dr. Abbasi, which is fabulous. What is your role right now at the Alliance Medical Group?
Well, to aid in diagnosis of back pain, conservatively treat back pain or any other pain. The great part about this is you have more than one doc from different disciplines helping in diagnosis and treatment, and it's rare and it's great that you can have more than one doctor helping. There's been multiple times where I've walked over to his office and said, I need your opinion, or can you see this patient?
Was he awake?
He was awake.
I'll wake up, we're having patients here.
But yeah, it's special. It's a good thing.
Tell me a little bit about your background, Dan.
Well, I'm a chiropractor, and I have a big muscle background. I'm a certified stretch therapist.
Stretch therapist.
Yep.
Could you make me 2 inches taller?
A little, yeah.
Terrific.
Get you playing basketball.
Put me down for an appointment this afternoon.
I'm full body certified in active release technique, which is great for any muscle adhesion, tendonitis, tendinosis, that kind of thing, muscle spasm. Also certified in Groston technique, which is instrument assisted soft tissue technique for scar tissue, plantar fasciitis, that kind of thing. So
Now, you're a native of Hazleton, right?
I am. I'm a James Street kid.
Yeah. Now, let me ask you something, because I could talk to you this way, because he doesn't understand. He's from Jersey. What do you think about the merger? Being a native here and seeing how the health network is run. What do you think about the merger?
I think it's great for the community. It is. It's going to improve healthcare in Hazleton.
So, and you feel that this would be something? I know how I feel about it, and it's a great plus for the area.
Oh my God, yeah.
Where did you go to school, Dan?
University of Tampa and Palmer College of Chiropractic.
Yeah, now you could have gone anywhere, but you decided to stay in the area. Right?
Yeah.
Well, that's good. I'm happy to hear that.
Thank you.
Now, with your involvement, okay, as I was talking to you before, the last 10, 12 years with the, the chiropractic shows we have, we have been able to, the chiropractors have been able to bring a lot of awareness to chiropractic medicine, because many years ago, chiropractors were not, doctors, I think, look down on the chiropractors. Okay, it's a whole different ball game now, right? No, not. He told me. He said, I look down on this guy. No, seriously. But now there is so much involved with chiropractic medicine, such as what, Dan?
Well, like I said, with the muscle work, pain-wise, you move a joint, it increases movement receptors, which inhibit your pain receptors. Then postural correction, strengthening, lengthening, breaking up any muscle adhesions, that kind of thing.
I think everyone at least once or twice a year should go to a chiropractor.
Their joints mobile.
Seriously, what's I know once a year at least get a good physical health exam, but what about chiropractic medicine? Once or twice a year or whatever? I mean, ideal is every month, but I mean...
well, you don't necessarily have to come every month, but to keep
if you're going to make me 2 inches taller, I'll be coming every day. Okay. So what is it, twice a year? Or,
Well, that's hard to say. Depends on your activity level, your what you do at work, that kind of thing.
All right.
Your posture, all that.
Yeah, some people have pain because of the way they, I remember when I was sitting different ways or laying on the couch, the way I'm sitting was, affecting my back. Folks, Dr. Dan Gavio, if you'd like to get in touch with him, his number is 501-570-6701. I'm talking to Dr. Ammar Abbasi, who is the Medical Director of Back Pain Center, and Dr. Dan Gavio, who is a chiropractor just joining the Health Alliance Group, and we'll be back right after this message. Welcome back to the Sam Lesante Show, folks. Remember, you can watch any of our health shows on ssptv.com, and also go to their website, Lehigh Valley Hospital, and you can see the health shows we have here. Very informative, and hopefully we're going to help a lot of people. We have in the past. My website, or my email is sam@ssptv.com. Appreciate the emails, pro or con. My guest today is Dr. Ammar Abbasi, who is the Medical Director of the Back Pain Center at the Health and Wellness Center at Hazleton, and Dr. Dan Gavio, who is a chiropractor at the Health and Wellness Center at Hazleton. So the Back Pain Center, which you're the Medical Director of, okay, describe that for us.
Sure. In 2012, in the fall, Jim Edwards came to me and said, I want to do a better job of treating back pain in our area. And so what we did is we reviewed the Institute of Clinical System Improvements guidelines as to what they do is they look at all studies related to treatment of back pain, and they look at outcomes. And we said, let's base our treatment, our program, based on proven ways of treating back pain. And so we set up the Back Pain Center to mirror their guidelines and their recommendations based on evidence, based on studies that were done. And so what they detailed in those reports is that obviously back pain evaluation is extremely important, especially if you have red flag symptoms like we spoke about earlier, but that chiropractic medicine, physical therapy, interventional pain management, and neurosurgery all play a role in treatment of back pain. And so the goal for us is to take patients through this sort of protocol or sort of this outline and really effectively treat their back pain. And so we've teamed up with a group of physicians. We work very synergistically, where we do a lot of communication. And so Dan is Dr. Gavio is one of those physicians of chiropractic. And we work very hand in hand together. And the Wellness Center, his suite and my suite are actually right next door to each other, so we often bounce ideas off each other and pull each other in on different types of patients. Our physical therapy is right across the way, right across the hall in that center, and I'm constantly talking to the therapist about different ways of working with certain patients, depending on what we see in the room, in the visits, office visits, or even bringing the therapist in on office visits. Dr. Hanlon is if patients go through therapy and and they've gone through chiropractic and medications, and they still having significant pain, and it's indicated, he is part of the evaluation process for doing interventional pain management or spinal injections and these types of things. And we also teamed up with Dr. Kimichi and the Lehigh Valley Neurosurgical Group as being an excellent resource. And I call them all the time if there's cases that I said, maybe they should see a surgeon sooner rather than later. And they're extremely responsive in getting patients in, seeing patients, and I like their approach. And Dr. Kimichi actually came up from Lehigh Valley to visit with us and spent about 2 hours with us at the Wellness Center, saw the center, and so we set up some guidelines about sending patients down there for evaluation and treatment. And they're very good and conservative in who they operate on and who's going to have good outcomes. And so what happens with that, and as sort of myself at sort of the hub of this, is that we allow cohesion of treatment of back pain, so that you're not just going to this person and they're not talking to the other physicians, but that there's integration of treatment of your back pain, and that we make sure that at the end that you're getting results, that there's improvement in function, that there's improvement in pain, and that everybody's on board in terms of your plan.
I think that's fantastic. You're talking about complete evaluation from A to Z. Okay, when that patient's in there, they don't have to worry, okay, well, here's your prescription. Okay, now you have another appointment with another doctor to check this, and then that doctor asks you this, and he maybe have to confer with you, and there's all these different things. I'm sure my viewers understand what they're talking about. Now it's from A to Z, correct? I mean, you got total evaluation, no matter what, bring the therapist in, bring the chiropractor, bring other, and everyone confers, right?
Right, and at the end, if there's any snags in any part of that process, any miscommunication or any issues, they always can come back. Any imaging done at the Wellness Center, pictures, x-rays, MRIs, is accessible to everyone. So, I mean, all these things are extremely important in making sure, you're not getting records from one place and you have to call for records. And I did an MRI 6 years ago and I can't get access to it. All this stuff is centralized. And so you spend less time sort of going through the logistics and more time actually treating the patient.
That's fabulous. So then right there, if I need any kind of physical therapy based on your review, you bring the therapist in and say, look, this is Sammy, we found this is what so everything is being taken care of, right?
What we do is I do communicate with the therapist directly. If there's any issues in therapy, or if the therapist notice that there's maybe the person's not progressing the way they need to, they contact me, they come by my office. Similarly, if the patient comes into the office and says, listen, I've done a couple of sessions and I'm noticing some issues, what they do is I can call the therapist in, I call the therapist on the phone, either I bring them in depending on what the situation is, and we make modifications, or we say, listen, maybe this avenue's not working for you, let's try something different, so that we're not spinning our wheels day after day after day and things aren't getting better.
I love it. Dr. Gavio, when you're talking about back pain, there's many areas of the body that create back pain, correct?
Yes.
Give me some examples that, where some of these things can come from.
Well, muscular can fix a joint, disc, like I said, posture could be from, something you're doing at work or the way you're sleeping, that kind of thing. But could be from a wide variety of things. That's why it's great to have more than one doc help diagnose this.
But getting back to my first question is that, let's say I have no pain, okay, I get along, once in a while, if I'm a firm believer, I take omega-3s every day, the PRN brand, I've been taking them for years. I think they work very well, but a routine checkup, I think, is very important, with chiropractic medicine, especially how advanced you guys are now. I mean, there's many areas that, could be something coming from, like you said, you could get a pain from, you don't know. Here's a person that had back pain, they had colon, problems, okay. How was that person?
Didn't make it.
Didn't make it. It was too far gone.
Too far gone.
Yeah. See, here again, if they would have, I don't know. If the symptoms would have been there and you don't know, we don't wish we had that magic.
I think with that person specifically, there was difficulty with access to care. They didn't have insurance, actually. And so for the longest time, I don't know how long she was having symptoms for, but by the time she finally was able to come, and get evaluated, I think it was a little late.
It's just so sad. It's just so sad. Folks, I'm talking to Dr. Ammar Abbasi, who is the medical director of the Back Pain Center, and Dr. Dan Gavio, who is the chiropractor there at the Health and Wellness Center at Hazleton. For Dr. Abbasi, his phone number is 570-501. 6380 for Dr. Gavio, 570-501-6701. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. My guest today, Dr. Ammar Abbasi and Dr. Dan Gavio. Dr. Abbasi is the medical director for the back pain, is the medical director of the back pain center at the Health and Wellness Center at Hazleton, and Dr. Gavio is a chiropractor there. You were talking about joint working together, okay, which is great because you have a chiropractor and you have, you and back pain. You have a story to tell me.
Oh yeah, I just the other day I had a patient come in late at 5 o'clock as an emergency visit, and she was in severe back spasms. She has severe back spasms, and so at that time she had already been on some medications, and I looked at her and I said, I don't necessarily want to increase your medications, and I don't necessarily want to send you home in pain, and I don't know if this medications are going to work for you, and another night in pain is another night in pain. I'd like you out of pain as soon as possible. And so I went over to Dr. Gavio's office, and I asked him, can you take a minute out of your busy schedule, come and see this lady? And he came into the room, and he saved me.
Well, we brought her over. She had severe spasms, actually visible muscle spasms.
You actually see the spasms.
Yeah, we did a lot of active release on her spasms and some stretch therapy, and we brought her in the next day. She had a few hours of relief, and we worked on her again, and she's doing better. And that's how it's great to coincide treatment like that. And it's great for any patient.
I think the working together is great. But any specific field, okay, chiropractic, even put it by itself, it's important, okay, and being evaluated if you have any kind of pain whatsoever. Don't wait till you get severe pain. Correct. It's always best to get things going when you feel things. Okay.
Absolutely.
Getting back to the person, just so our audience knows, okay, if the person had health insurance, okay, and would have been able to at least come in there. But however, I don't know, even if you don't have health insurance, you still could go to the emergency room and you still could get taken care of, okay? That's one of the great things about the country so far. What would you been able to, what would have been the first telltale sign there?
I think if she probably was having a check with her primary, if there was something that was coming up sort of abnormal, then the primary could have done primary care physicians are excellent at doing, because they're so broad in their scope that they can catch things early and they see a lot of these things often, that they would have gotten her to either us or to where she needed to go as soon as she needed to. For her, I think the first time she noticed what happened with her is that she had a fall, about 4 months prior. And nobody really looked at the details as to why she fell. And so she fell. I think they gave her an x-ray, she sent her on her way, and she continued to have pain and falling. And any change in function is extremely important. If you're not able to do what you were doing before, something's changed in your body, and we need to know what that is.
Especially elder people today, and we have a lot of them in the area. That's why it's so important for elder people, if you're late 50s, early 60s, or early, whatever. It's important to get to at least get a physical exam, because you're at the age when you start aging, and some things could be developing that you don't know, okay? And certainly the alternative is being dead. So the point is, stay healthy as much as you can. I think the center is doing great, isn't it, Doctor?
Yeah, we're having good success. I think patients are really gravitating towards our model.
And you've seen a lot in the last 18 months, haven't you?
Yes.
Yeah. You've gone through the merger, and you think that all the doctors are excited about that, right?
Yes, we are. I think we're excited about being part of something larger, and I think that those folks at Lehigh Valley are pretty excited about being part of us too. So.
Oh, listen, Jim Edwards and his entire team developed something great here. I mean, they were fortunate to be able to, at least I think, to make the merger. But it's a great hospital. We're very fortunate in northeastern Pennsylvania. There are a lot of great hospitals around. Doctors. I tell people all the time, Dan, you'd appreciate this. You hear this when you grew up. Well, you got to go out of town. You have to go out of town. You don't have to go to town anymore. We have great doctors here. Wouldn't you agree?
I do. We have
except for this guy, but other than that, no, I'm only kidding. Okay. Well, listen, thanks for coming on the show. It's always good. It's always a pleasure. Dan, good luck to you. Okay, we'll see you Dan Gavio, Dr. Gavio is the chiropractor now up at the Health and Wellness Center at Hazleton, and Dr. Ammar Abbasi. Phone numbers, folks, for Dr. Abbasi, if you're having any kind of pain whatsoever, just give him a call, 501, it's 570, of course, 501-6380. And for Dr. Gavio, 501-570-6701. Any questions you have, please give him a call. Stay healthy. We'll see you next time.